Arthritis knee surgery refers to various procedures to address pain and mobility issues caused by arthritis in the knee joint. These can range from minimally invasive arthroscopy to total knee replacement, depending on the severity and location of the arthritis. Here's a breakdown of common knee arthritis surgeries. 1. Knee arthroscopy. A minimally invasive procedure where a small camera, arthroscope, and surgical instruments are inserted through small incisions to visualize and repair the joint. May be used to remove damaged tissue, smooth cartilage, or repair meniscal tears. Not typically used for advanced arthritis but can be helpful for addressing accompanying issues like meniscal tears. 2. Osteotomy. Involves cutting and realigning the bones of the knee joint to shift weight bearing away from the damaged area. Suitable for younger patients with early-stage osteoarthritis affecting one side of the knee. Can delay the need for a total knee replacement. 3. Partial knee replacement, also known as unicompartmental knee arthroplasty, replaces only the damaged portion of the knee joint, either the medial or lateral compartment, with a prosthesis. Less invasive than total knee replacement with a shorter recovery time. May not be suitable for all patients, particularly those with significant arthritis in multiple compartments or ligament damage. 4. Total knee replacement, also known as total knee arthroplasty. The most common surgery for advanced arthritis involving replacing the entire knee joint with a prosthetic implant. Effectively relieves pain and restores mobility for most patients. Recovery can take several months, with full recovery taking up to a year. 5. Patellofemoral arthroplasty, a less common procedure that replaces the undersurface of the kneecap and its groove, trochlea, if these are the only parts affected by arthritis. May be a good option for some patients with arthritis limited to the patellofemoral joint, but it has a higher failure rate than total knee replacement. Considerations. Surgery is typically considered when non-surgical treatments like pain medication, physical therapy, and injections are no longer providing adequate relief. The best surgical approach depends on the individual's specific condition, age, activity level, and overall health. It's crucial to discuss the potential benefits and risks of each procedure with an orthopedic surgeon to determine the most appropriate